Hello and welcome to your lecture. In this recording, we're going to walk through about 50 muscles of the body. For nomenclature, we will identify some that you may want to be aware of as far as action, origin, and insertions. So let's break this apart into sections so that you know what you have coming up. Okay. Remember that the human body has about 700 different muscles. We're taking a very brief survey of musculature. You will also notice within muscles of the body, there are layers. There's a deep layer and a superficial layer. So we'll kind of mix them together. If I remember, I will identify superficial in contrast to deep. But usually through the pictures, we'll be able to tell what's what. Now, as we walk through these will be relevant for the 40-question multiple choice online practical on muscles that you have set within your course page. It's 40 questions, but it's 20 points. Hopefully this simplifies it all for you. Again, I will go through the whole list also posted on your course page and identify particular muscles that you may want to pay attention to for origin, insertion, and actions that will be related to your one homework activity, but also your matching quiz on origins, insertions, and actions. Okay, so let's break it apart. We'll start with head and neck. Let's look through some of the muscles that we can identify on head and neck. So first of all, the thing I want to point out is that you have a connective tissue on the very top of your calvaria. We call this the epicranial aponeurosis. It'll lay across your parietal lobes and go to the back around the or near the occipital lobe. The first muscle that we will have up front will be the epicranius frontalis, or the frontalis muscle. Notice that the nomenclature will match the bone that it overlays. This is going to happen a lot, and we'll see this also, nomenclature relating similar structures to nerves when we get there. The epicranius frontalis. This is one you may want to be aware of for origin and insertion and actions. It has the action of raising the eyebrows and wrinkling the forehead. Its origin is the cranial aponeurosis, and it inserts on the skin of the eyebrows. As we discussed already, origins and insertions. Origin is the part of a muscle that primarily stays anchored and stationary, whereas the insertion will be connected to whatever it's trying to move. Oftentimes this is a bone, but in this case, in the frontalis muscle case, we're seeing that it doesn't always have to do that. And in this case, it will be attaching to skin. We're going to look at another picture so I can show you this muscle here called the occipitalis muscle that is going to overlay the occiput. It's the epicranius occipitalis. It will pull the scalp posteriorly. It will originate on the occipital bone, the temporal bone, and insert on the epicranial aponeurosis. The next muscle that we want to touch on will be the orbicularis oculi muscle. Hopefully the nomenclature gives you the indicator that it will be a circle around the eye. So the orbicularis oculi are circular muscles around our eyes. This particular muscle will allow you to close your eyes, squint, and blink. It originates on the frontal bone and the maxilla and inserts on the tissues of the eyelid. Next, we have the orbicularis oris. This is going to surround your lips. Again, orbicularis oris hopefully will give you the indicator that the nomenclature holds within it, so that it surrounds the mouth and the lips. The orbicularis oris will compress and close the lips. It originates on the mandible and maxilla and inserts on the skin and muscle around the mouth. This is a muscle that you may want to be aware of for your quiz. When we talk about the buccinator muscle, you can see it pretty well on this picture here. But I think you can see it better on this picture here. Now, the buccinator muscle has the activity of compressing the cheeks. It originates on the mandible and the maxilla, but this guy will insert on the orbicularis oris. So really, this is kind of like it'll help purse the lips, whether for facial expression or for chewing maybe. The zygomaticus muscles, you have two, a major and a minor. And as we go through musculature, you will notice that generally, according to size, not always, sometimes it's location oriented that delivers a muscle its name. In this case, zygomaticus major would be the larger one, and the minor one is a little bit thinner. And the zygomaticus minor is closer to the orbicularis oculi muscle. Now, the zygomaticus muscle group, they raise the corner of the mouth. They will originate on the zygomatic bone and insert on the skin and muscle at the corner of the lips. The platysma muscle, this guy is large and very strong. Look at its placement, and we can see it here as well on both sides of the throat, anterior portion of the neck, really, or anterior portion of the body. Now, this muscle, on this model, we can see it as well as this layer of musculature. This will pull the lower lip down and depress the mandible. It will originate on the pectoralis muscle and insert on the mandible and the skin of the lower face. When we get to the masseter muscle, you can see it well on both pictures here. Here is the masseter muscle. On this model picture, we can see the masseter muscle kind of underneath this here. This gland here on the muscle, that's the parotid gland. The masseter muscle, this is one you want to be aware of for your origin insertion quiz. It helps close the jaw, and it is one of the muscles of chewing. It originates on the zygomatic arch and maxilla and inserts on the mandible. When we get to the temporalis muscle, you can see it very well on this picture. So we'll just keep choosing these guys. And then on this model, you can see it there as well. The temporalis muscle is a synergist of the masseter in the closing of the jaw. Let's super side note and talk about muscle synergy. Actually, anytime you use the word synergy, it is two muscles working together to give a more atomic outcome, meaning this. It's like one muscle will do a little bit by itself, but when you add them together, it's like 1 + 1 = 3 now, rather than 1 + 1 = 2. So it's synergy is like more than the sum of the parts. When we have antagonistic muscles, those are ones that will oppose one another in their activity. So these masseter muscles, then, they originate on the temporal bone and insert on the coronoid process of the mandible. We can see a little bit here. There's a better, one of the other pictures is better, so I'll show it to you in a minute. The next muscle on our list is a sternocleidomastoid. You can see this band, it kind of lies posteriorly and or underneath the drape of the platysma muscle. On the model, you can see it a little bit better. Its orientation, I think it's a better orientation than we're looking at on this other picture, but this picture from the book, rather than the model, this guy has his head turned. So let's look at this one. No, I guess that was the best one we have. I apologize. Let's look at that one again. Sternocleidomastoid muscle. This is one you want to know for your origin and insertion quiz. It has the ability to flex the head. So chin to chest action, but also it rotates the head to the opposite side of the muscle. So the one on the right will turn the head to the left and vice versa. It has its origin on the sternum and the clavicle. If you look at the name, hopefully that would help you figure that out a little bit. And then it inserts on the mastoid process of the temporal bone. So it's originating on the sternum and the clavicle. That's the sternocleido part. And then mastoid tells us where it inserts. And the last muscle we want to look at as part of the neck and head. Let's see if I can find a good picture of it. Okay. Still not on this picture. Let's see. Hold on a second. See if I can find it. The last muscle we have is the splenius capitis, and I don't see a good muscle reflected of this. I'm going to keep looking. I will tell you where it is without being able to show it to you on here. The splenius capitis muscle will be a muscle actually, hold on one second. Okay. Okay, here is a picture of a cadaver specimen with the splenius capitis muscle highlighted in purple. So the splenius capitis muscle will extend and cock the neck. It will originate on C7 vertebra through T3. It will insert on the nuchal line and mastoid process. So the origin is along the spine. The insertion will come up here, and I did not have you know where the nuchal line was, but it is a ridge on the back of the occiput. So it's inserting there as well as the mastoid process of the temporal bone. Okay, so that is all for our muscles of the head and neck. Stay tuned for the next one.